Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Right, so you sit down, back hurts, standing up, your foot hurts, so it's hard to find a comfortable position. Okay, don't stand or sit, just sleep all the time.
Right,
I'm
so I
just
have to
joking.
kind of.
I had a patient had issue like this, and especially with sleeping, so the doctor said, don't sleep. I'm like, oh, that's really nice. Okay, so what else?
That's it.
That's it, okay. So
The problem like having like a shooting pain and a burning seems like coming to the
you start to have some symptoms on the other side.
Right.
Okay, so you probably start to walk funny, stand funny, so you start to have more compensation on the other side.
Okay.
That will start to have issues on the other side. Okay, so let's focus on this. We're going to teach you the proper way of walking after we're doing the release, because if you're still doing your poor body mechanic and ergonomics after the treatment, that's going to cause issue on the other side. So we want to really do the treatment and actually decrease the risk of having issues in the future.
Okay.
So I will have you stand up and we'll have you walk. We're going to walk back and forth and tell me how do you feel.
Right now, something on my foot, so it's really,
on the bottom of your
Yeah.
foot, okay. So you feel just you're standing on a rock, or
yeah.
what about the burning the calf? How does that feel?
Usually burning. That's it in the evening when I go to bed.
Okay, let's walk back and forth. And go back. You definitely need to work on your gait. Okay, so I want you to hold on the table and do heel raises and tell me how that feels. Any pain, discomfort with that?
Yeah, my calf.
Your calf, how much from 0 to 10?
About 3, 4.
Okay, let's do 5. Hold in here. So I'm gonna use the walking and we're gonna use the heel raises for reassessment after the treatment. Back and forth, up and down. 5. And tell me how much pain.
It's very uncomfortable.
0 to 10? That's more than 5.
4 maybe.
Okay, and where do you feel it exactly? You can stop.
Yeah, right here.
So we have several issues. The calf, and you have the plantar part of the possible Morton's neuroma, okay? And, okay, anything else? Let's do sit to stand and see how you feel with that. You stand up.
Yeah,
It's in the back.
yeah.
We have 3 issues here, okay? But your feet was okay?
Yes.
Okay, so let me focus on the leg for now.
Mm-hmm.
See how you feel, because the back, that's something could be else or could be related. So this is the calf you have issue with,
Yes.
and I can feel really very thick knot in here, really thick scar tissue right in here. And that, because our muscle should act like a rubber band when you contract and relax, stretch like this. When you have a scar tissue, it's like you have a knot in the rubber band, so when the muscle contract, it does not stretch much, and that's limited his range of motion. That's why when we start to do some stretching position or motion, like he raises, you start to feel it in the calf, and I'm not surprised because that feels like an inch length. And here we have an issue with, he feels he stands on a rock, and that's usually like a scar tissue and inflammation in here. So I'm gonna work on this too, see how you feel. If everything is fine, so I address this issue. We're gonna get to the back issue maybe later, if it's not today. How that feel? Everything should be pain-free.
Right. No problem.
So if you feel pain, let me know, okay?
Mm-hmm.
And try not to kick me, okay? Is that okay?
Yes.
Okay. So I'm gonna get to that knot.
Okay.
Can feel it here. Really thick knot. How'd that feel?
Okay.
on this area that he's complaining of the feeling standing on the rock.
Good.
Painful?
Yep.
Oh, okay, sorry. What about now?
Okay.
What about now?
Okay.
Okay, I'm trying to actually go deeper a little bit. See how far I can. Feel that?
Yes.
That's a very thick scar tissue here. And you can see my tool is just going over like this, and I can feel the vibration. And you can hear that sound, it's very loud here. And where you hear the loud sound, you can see the redness of the scar tissue here. Look at this. And you can see actually the map of the scar tissue, where he has redness on the spots. So we're gonna release the whole area. There's not much, let's lift your legs up. There is not much inside here, I'm not feeling much. Is your pain mostly outside here?
Yeah.
Okay, so that makes a lot of sense with all the scar tissue he has in this area. That's very thick knot here. Is that painful? It's okay.
It's okay.
So, let me get the whole area here. You hear that? Okay. That's the scar tissue music. Ah. There you go. Here. Okay. Okay, now I'm gonna work on this area. And you said the pain, the numbness in here, that's usually at night?
Yes.
Okay. So, I'm gonna get really deep in this spot. How's that feel?
Little funny.
Okay. It's fun to be here, by the way, you know. We not try to tickle patient on purpose, but if they don't laugh, we tickle them. How's that?
Okay.
So this is where you feel the rock when you stand on it, yeah?
Yes.
But any issue here? The plantar part in this area?
No. But it's painful.
Sorry, okay, what about now?
That's okay.
Okay, I'm gonna get some motion. So if he's stuck in a proliferation stage, which is the scar tissue stage, that's, he should feel better just doing this release. If he has inflammation, I'm not gonna use a Magna Heal, that's what we use to help decrease the inflammation, just to rule out if his symptoms from scar tissue, fascial restrictions, or that plus the inflammation. So I use the Magna Heal as a diagnostic and treatment tool at the same time. How's that?
Okay.
I start feeling actually start to loosen up here, this knot in this area. So walking, how's that feel?
Oh,
Back and forth?
yeah, I can walk much lighter. Now the
Nope.
thickness got little lighter on the bottom of the foot.
Okay, he definitely walked much faster than when we started. He walking a lot, like more faster than when we started. So let's do the heel raises. You can hold on the table here, just back and forth, and tell me how does the calf feel? Up and down. And you can see here the scar tissue. Look here, the map of the scar tissue, and you can see it's sticking out. So he might feel relief today, but he will need to do more work on himself because that scar tissue very thick, and you can see it is sticking out here. So it's gonna take a few treatments to really totally break it. How's that? Any pain, discomfort when you did the hair raises?
Yeah.
You did a lot more than the first time, okay? How is the calf tightness? It's still feel it or it's gone?
It's much loose, you know. It's still a little bit tight, but much loose.
Where do you feel the tightness now?
Right here.
Right in here, okay. What about the bottom of your feet?
It's I think a little thinner than.
Thinner?
Yeah.
but you still feel it a little
Right,
bit,
yeah.
okay? So we started with how much when we came here, like 5, 6 or something like that?
Yeah.
Okay, now how much?
Probably 3, 4 on a, thickness.
Both of them?
Yeah,
The foot
yeah.
and, okay, so let's lie on his stomach. He has a little inflammation, so I'm gonna use the Magna here. So if he has a mild inflammation, it should be a few minutes. Lift your legs up. So he complained of this. I'm gonna just release this a little bit quickly here, just to make sure if he has any scar tissue, we get rid of it. And then I'm gonna use, yes, he does have a scar tissue here in this spot. Most of his complaint was in this area, that's why I was focusing on that. But here, he definitely has a scar tissue. Is that too much or it's okay?
That's okay.
Okay, so I did that. Now, I'm gonna use the Magna Heel. Comes in with belt. I'm just took it over the belt, so to do a quick treatment, you didn't have to take it off. But patient can wear it at night or throughout the day. Use it with the belt that comes with it. How that feel?
Okay.
So if he has mild inflammation, a few minutes should be enough to really get to help with that inflammation. So that's why I use Magna Heel as a diagnostic and treatment tool. If he has moderate to severe inflammation, he may need to wear it throughout the day with the belt, or at night, put it in a sock, or with the wrap that comes with it, just sleep with it. Usually for the foot, I recommend you do it at night. You don't want to walk on that, But if it's in the calf here, you can wrap it here very easily, and walk with it, exercise, or just do your normal life routine. How that feels? So it was here. You did not feel tightness here?
No.
Not here? Okay, but I thought this very thick scar tissue here, so I just want to make sure I get this down a little bit. Gonna work it in here. And here.
Do you think I have a Morton's neuroma?
It's the location of the Morton's neuroma. It's the symptoms that usually presented with Morton's neuroma. Feeling you standing on a rock. It's a swelling. So this is very like typical symptoms of Morton's neuroma. The location, the symptoms you are experiencing. Usually they confirm that with ultrasound, But if we look at the normal healing cycle, you don't want to worry about diagnosis, because diagnosis is just to tell you the location of the problem. But in real life, it's part of the healing cycle that's stuck. So if you understand the normal healing cycle, you're really going to get to the root cause of the problem by knowing where the body's stuck. Is it in an inflammation stage, proliferation stage, which is the scar tissue stage? Which one that the body's stuck in? And that would be helpful for the treatment than just tell me the location, That's why I don't like to label a patient with diagnosis. Okay. So let's walk back and forth and tell me how's the calf, how's the foot feel.
Okay.
How's that?
Okay. Calf is much looser.
Okay.
I don't see any
Okay.
tightness, but the bottom is
Of the
still
foot?
there. Yeah.
How much in the bottom of your foot?
But still 3.
But the calf, let's do the calf raises and tell me how that feels with the calf. Just back and forth.
problem.
So the calf is improving, you still have some issue
Yeah.
in the
It's
foot.
Still
And
right
that's
here.
right.
Yeah. Here.
Okay, I'm gonna do a couple.
There you go.
How's it feel?
Okay.
Now I'm gonna use this tool again to see if he tolerated. He did not tolerate it the first time, okay? How's that?
Okay.
Wow.
It's fine? Yep. So I did fascia release with my hand, just because it's in the area like really very between his fingers. Not his fingers, that's not fingers, those are toes, okay? Bad anatomy, very bad anatomy. Those are fingers. So I actually can use this tool, but I decided not to do it because he was sensitive to it. So this is the A5 that can go really deep, up to 2 inches or even 3 inches in the body. So, how does that feel?
Okay.
Okay. So I'm actually really digging in. Here, how does that feel?
All right.
So he's really tolerating a lot. He was saying that he could not tolerate even the touch in that area, in the front especially. So most of your feeling was in here, not here now.
Right.
This, the issue. Is that correct?
Yeah.
Okay. How's that?
Ooh, that hurts.
Okay, I went a little bit deeper. Okay, so I'm gonna use a magna heel a little bit on that spot specifically. Because he has a little bit inflammation. Hopefully it's mild inflammation, so we can get this under control now. How's it feel?
Okay.
All right. Definitely look like you're walking upright more. How's that?
Yeah. My leg is much loose. Foot is loose,
Okay.
but the still thickness is still there. You know.
How about the pain? Because the thickness, that's gonna take a few sessions to totally break the scar tissue.
Okay.
Think about what we're doing. You have thickness of a scar tissue. If it's 1 inch,
Mhm.
what I do with the tool is shaving it, okay? Especially if you have vitamins and mineral deficiency, that shaving gonna take a longer time. That's why we're gonna check your vitamins and mineral.
You know.
But
uh,
pain-wise,
Yeah. Except I'm comfortable with the thickness, you know. Yeah.
So let's do the hair raises and tell me how that feel. The calf and the foot.
No.
Any issue with that?
No.
So that was like discomfort in the calf area. Now the calf is fine.
Oh, especially my toe area, I wasn't able to bending too much now because
You could not bend. He could not like put pressure on his toes. Now it feels
Yeah.
okay.
yeah. So I wanna try.
You see, before he said it was very sensitive to touch. He's actually pushing down on his toes like this.
Still, I have when I try this, I see here.
You feel pulling.
Yeah.
That's very normal because I'm gonna show you actually the scar tissue. This is very good case. I will have you stand up. Stand up. You see the thickness of the scar tissue? That is thick. That's very thick. The length of it is about 1 inch or 1.5 inches, and it's deep in. So my normal expectation, this is not gonna be one session to totally break it. I recommend for him he get the tools and he continues shaving it, because that's a very thick scar tissue. My goal is to get his pain under control and just kickstart the normal healing cycle. So when you work on it, it takes a few sessions to really get rid of it. But you can see it's a very thick scar tissue. That's going to take a few sessions to break it. And that's because our muscle should act like a rubber band. When it contracts and relaxes, stretch like this. When you have a scar tissue like this one, it's like you have a knot in a rubber band. So when the muscle is stretched, it does not go far. And that's what happened exactly when he does heel raises, because that's actually stretching the muscle. That's scar tissue in a way, and visually very obvious, you can see it.
Yeah.
But the good news is actually he's doing it unconsciously so many times. That's mean he's really, how you feel?
So this I wasn't able to do it.
He was not able to do the pushing on it. How's that?
Okay.
Yeah. Let's walk back and forth and tell me how that feels. Okay. How's that?
Okay.
So you had chiropractor, you had acupuncture before. So what do you think about ASTR treatment?
Yeah, that's what I've been looking for. It's some solution.
Yeah. So can you tell a difference just working on it a few minutes?
Yeah.
All right. Awesome. So that's good. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.